We're now here with Ann Jenkins, who is the CEO of the American Association of Retired Persons. You've been the head of that organization for 4 years?
5 years.
5 years. And for those who may not yet be retired or a member, what is the American Association of Retired Persons?
So AARP is a social change organization that's focused on making life better for people over the age of 50. And we have over 28 million members across the country, an organization that is over 60 years old.
So you're the largest membership organization in the United States, is that right?
We are the largest social change organization, membership organization, particularly serving the interests and needs of 50 plus, yes.
Now, when I turned 50, within a day or two of my 50th birthday, I got a thing from the American Association of Retired Persons saying you should sign up. I said, 50, I'm not retiring at 50, so why do you send it to people who are 50? Because people at 50 aren't retiring, are they?
No, in fact, hopefully your solicitation should have come 6 months before you turned 50, but...
Maybe it did. My memory's not that good as I get older, but maybe it was 6 months earlier.
But it really has been focused on people who are 50 and older. It really is about how do we bring and engage. We know that our members are no longer retiring at 50 or 60 or 70. This increased longevity, which is allowing people to live 10, 15 years longer, is increasing the lifespan. But our focus is around what we call health, wealth, and self, helping people live longer, healthier, so that they're not in that period of decline for 10 or 15 years, but they're actively and engaged. And many people have to stay working because they either have to, because of financial means, or because they want to, because keeping people engaged and away from isolation allows people to live 6 to 7 years longer than normal. Okay,
everybody knows that it is said that because of the coronavirus, the people most at risk are older people, people who are 60 or older, 70 or older, or 80 or older. We don't know exactly the reason for that, but you have a lot of those people in your organization. So what are you doing to help get information to these people about what they should do?
So this is the moment I think AARP has been built for. We have state offices all around the country. We are constantly engaged with putting out information, getting our members to focus on that information that's coming from the Center for Disease Control, listening to their health care providers, activating telehealth and making sure that they're keeping in touch with their local doctors. On Tuesday, we hosted a town hall meeting with CDC and SEMA over at the CMS, and we had over 100,000 of our members call in or join us on Facebook just to get transparent, clear information about what they should be doing.
Right. So what are the biggest questions that your members have of you about this situation?
A lot of the questions that they have is around the cost of how do they contact their doctor? Do they actually go in, or do they call them, or contact them using some of the telehealth? They're concerned about whether or not Medicare is going to cover it, so we're glad that the Congress and the White House passed legislation adding additional funding for those sources. They're concerned about travel, and should they, if they've planned some kind of vacation, should they be doing that? And so we're trying to make sure that they have the best medical and scientific advice.
So it is said that a good place to avoid, some people would say, is a cruise ship right now.
Yes.
And it's also said that many people who are, let's say, members of your organization maybe use cruise ships from time to time. Do you recommend somebody go on a cruise ship right now?
So our focus is on the member and making sure that they're following directions from the Center for Disease Control. And they've said that you shouldn't be in situations that has more than 250 people at this place. And so we would caution them, particularly as it relates to their health. They have to make their own decision, but that the medical professionals have said it doesn't make sense for someone to be doing that.
So one of the most effective lobbying forces in Washington is said to be the AARP, because you have such a large membership and you're from all over the country. So are you up on Capitol Hill lobbying for anything in particular right now relating to this virus?
Well, we certainly played a part in trying to make sure that Congress passed this additional funding, the $8.3 billion, because that's going to be so important for covering of Medicare and Medicaid costs, and also transportation costs related to getting health assistance. Obviously, at the forefront of what we're doing is bringing down the cost of prescription drugs and trying to get Congress and the White House to really address some of those issues. And this pandemic has really escalated those kinds of things that we want the Congress to be focused on.
Now, under the Stafford Amendment, it is said that if it is invoked, $50 billion or more can be expended without affecting budget limits and so forth. Are you in favor of the Stafford Amendment being invoked or not?
Well, we're working closely with both House and Senate to look at those issues to see how they're going to impact other programs to make sure that particular legislation is not going to affect Social Security and Medicare and other costs.
Right. So how many employees do you have in Washington, D.C.?
We have about 1,800 here in Washington, about 2,400 total.
All right, the 1,800 in Washington and 2,400 total. Are they coming to office today? Are they working from home? What are you recommending that they do?
Today, all of our employees, contractors, temps, interns are working from home as we're testing our telework systems to make sure all of that in anticipation that it may become the norm for us to be working from home.
And you expect this to continue for weeks or longer?
Well, I think for us today is the test day, and we've notified our staff that we'll be letting them know either later today or over the weekend.
Now, as the head of the AARP, you obviously want to be healthy and you don't want to be getting this virus yourself. So what are you personally doing to avoid getting this, if you can?
Well, what I'm doing is following my doctor's advice about making sure that I'm not in crowds, that I'm drinking lots of water, that I'm protecting myself and exercising and trying to eat healthy.
Okay, so is this the biggest crisis the AARP has ever faced in terms of a national emergency, or is there anything that's similar to this before?
Well, I think this is the biggest crisis, health crisis the country has ever faced. And so from that standpoint, we're trying to make sure that we're pushing out information, whether it's on our website or social media, to make sure that our members have access to the best available information that they have.
Now, my job isn't to get members for the AARP, but I'm just asking you, why should I want to be a member of the AARP? I'm old enough to be a member. I don't know if I actually am a member. I'm not sure I am. I guess I will be after this interview. But
indeed you will.
But why should somebody want to be a member of the AARP?
Well, you know, as I said, AARP is a social change organization, and our job is to make life better for people as they age. And so we do a lot of advocacy work, not just here in Washington, but in all of the 50 state capitals around the country, in addition to educating people around that health security and financial security, and really living longer and healthier and being passionate. In addition to that, we do provide discounts, but the discounts are not necessarily at the forefront of why we want you to be a member. We also run the ATM, the magazine, which is the largest magazine circulation in the world. We hit 26 million households past People magazine 3 years ago. And so not only through our publications, but through our online newsletters and content, we're probably in the majority of households around this country.
So your magazine is more interesting than a People magazine, or just
Absolutely.
has a bigger circulation?
It has, it's both. It has the largest circulation and it's the most interesting.
Okay. I'm just curious, before you became the head of AARP, what did you do? What was your career path?
So I was the Chief Operating Officer at the Library of Congress under Dr. Billington when he was there. Spent 15 years there at the library, and before that I worked in both Reagan administration and Bush 41, and then went over to the Library of Congress and joined AARP in 2010.
So if somebody is watching and they are a member of the AARP and they have a question about what they should be doing, what do you recommend they do?
I recommend that they go to aarp.org/coronavirus.
Okay. I thank you very much for giving us your time, and I'll look into whether I should join the AARP. I guess I'm not sure I am a member. I know I'm old enough, but I don't know whether I actually joined. Maybe I am.
We'll make it simple for you and send you that membership.
Okay. Thank you very much. Appreciate it.